Hey guys, so this is a short podcast on the patient chest x-ray that I posted earlier. This was a 50-ish lady who came in via EMS after she fell into a hole, unsure of the depth, and did have a witness loss of consciousness, large 5 centimeter laceration on her scalp, and complained of some chest pain, mainly on that left side. She head CT was negative, cervical CT was negative, and then this is the chest X-ray. So start with the basics, A, B, C, D, E to read chest X-ray. Do it in a logical, organized pattern every time so you don't miss it or miss anything. Don't just look at an X-ray and try to pick out the abnormality because you will miss stuff, guaranteed. So A for airway, you can see the trachea coming down here. You can see it branching. Looks like the crine is right about there. Looks fairly good. B for bones. Let's start on the right side. So ribs, here's first rib coming around, second rib, third rib, fourth rib, and all these are looking okay. These here are posterior ribs, of course. The anterior ribs are coming down here. These are your anterior ribs. So the right side ribs look good. Clavicles, you can see by looking at the clavicles, the patient's probably turned just slightly. But the clavicles look, my pen would work. The clavicles are looking okay. This clavicle here, there's some question about a fracture. And I think people are looking at this here. Let me erase that so I can show you what's going on. You can see the first rib. This is the first rib coming down here. And it's making it look fragmented, like it's a fracture, but it's actually not a fracture. You can see that it's just the first rib coming down here. This is the inferior part of the first rib. And here's the superior part. Of course, it hides behind that clavicle. So you can see that that's what's making that look like it's fractured. So moving to the left side, the clavicle's fine. Look at the bones. We look at the first rib, second rib, third, fourth. Now this fourth is looking a little unusual. Let me blow this up here, maybe. That's not going to stay blown up, I'm afraid. Oh well. So you can see right here, the inferior part of the rib is coming down. And then here, you can see there's a step off right here, as well as here, and here, and here, and here. I don't, yeah, there might be, let's count the ribs. Let's see, 1, 2, 3, so that's rib 4, 5, 6, 7, and 8 for sure. So that's 5 broken ribs. I don't see anything on 9, but you'd get a better film if you got obliques. They just did a chest x-ray on this one. But you know you have at least 5 broken ribs. Definition of a flail chest is having 2 or more ribs broken in 2 or more places. So this doesn't fit the definition of a flail chest. So on to the rest of the x-ray. We got the bones. C for cardiac silhouette. You can see the aorta there. Here's the heart. And the cardiac silhouette looks fine. D for diaphragms. Left diaphragm, right diaphragm. That's fine. E for everything else. I'm going to erase that so we can really look and see if there's a pneumo. And I'm going to get rid of this for a second, blow it up so we can all see here. So you can see there's good vascular markings all the way out. So there's not a pneumo. And you can, let me get this back up, you can look by vascular markings, these little thin lines go all the way out to the edge pretty much. And you can look here, obviously want to see if there's an effusion, and I don't see one. The margins are pretty clear. So, but it's definitely something to watch for, because more than likely she's bleeding in there. And that concludes this chest x-ray. I hope you guys enjoyed it. Any questions, please feel free to ask.